Hello, my name is Brooke, and I work in the informatics department at Memorial Hospital. Today, I'm going to talk about how we can cancel events and discontinue orders. Now, before we go any further, sometimes the word cancel and discontinue is used interchangeably, and you can discontinue an order, and you can cancel an event. However, in an audit trail, a canceled isn't always the most attractive, and it definitely needs a reason as to why the nurse is canceling something that is either ordered as a daily care for the patient and or a physician event that was ordered. So one way we can cancel events is through our work list. Notice that these scheduled statuses are here on your right, and then we have the date and time here. So let's say that we'd like to cancel the next upcoming event, which it's around 10 a.m. So I'm going to grab this hourly rounding and just double click. Notice down here we can choose to document, we can choose to cancel, and we also have this reschedule option. Now, if this patient is simply sleeping or if they're out of their room, those kind of events can simply be rescheduled to a later time. However, if we truly needed to cancel this for reasons such as the patient has been discharged, maybe there's a change in their status, you can choose these options here, or you can choose a free text here. And we advise to be as specific as possible, but again, we'd rather that you not have to cancel an event. We would rather you simply reschedule. So I'm just going to put testing purposes here. And in doing so, I hit OK and accept my cancel. That is only going to cancel that event time. However, we can see that the other hourly roundings are still listed. Another way to cancel an event is through patient schedule. Patient schedule, in order to cancel an event through patient schedule, you look for the abbreviated name of the event and around the time that it's scheduled for. So if we look again at 10 o'clock, we can see here that that hourly rounding is in blue. And when something's in blue in patient schedule, that means that it is done. So we can see that if we were to click on this, it would show that that has been canceled. But let's go to a different one. Let's go ahead and go to this next one that's also the hourly rounding. And I'm going to double click there. Again, we have these options. But this time, I'm just going to reschedule because I know the patient is going to be back in the room, or I'm just allowing them to sleep a little longer. So I can choose to free text that, or I can choose another one of these options. I'm just going to choose a sleep and OK. And then it's asking me what time I'd like to reschedule. Well, I would like to reschedule this in like 30 minutes. So it's just looking for the time. It's not looking for the date. It's assuming this is going to be in the next 24 hours. So I am going to go ahead and put a time of 10:30 and OK. All right. Now it shows here that this will be retimed and rescheduled to 10:30. So that doesn't cancel anything as far as patient care goes. That actually lets us just go ahead and revisit that event. Another way you can cancel is through the MAR or the IVAR if it's specific to a medication or IV. Again, we have these options down here of cancel and reschedule. We advise that you, of course, reschedule a medication that's maybe going to be a little late. And our system recognizes 30 minutes before and 30 minutes after as being somewhat normal, but after that time, it's going to give you a warning and or alert to reschedule because it's outside of the actual medication administration time. So if we were to choose to cancel this 9 o'clock February medication, I would double click. It's asking for me to, excuse me, I didn't mean to double click there, I apologize. If I choose to cancel this, I would choose cancel down there and then click on this item. And then it's going to ask for that cancel option here. And again, be as descriptive as possible and choose your option and OK. And then it's just going to cancel this cancel event. It's not going to cancel all the medication or all the timings for this medication. It's only going to cancel this specific one. So there I would just choose accept that cancel. Now, different from canceling an event is discontinuing an order. To discontinue an order means to stop everything going forward if there's a frequency involved that's more than one. So I'm going to go into my order management. I'm going to place the author. A nurse cannot cancel physician orders if directly. So you must, if you get a call from the provider or a verbal, you're going to use these options here. So if, let's say, Dr. Cross calls and she wants to discontinue an order, I'm going to choose this telephone option, and then I'm going to choose her as the order author and OK. And then I'm going to go straight to this order history tab here and take a look at these orders. And this is where we would choose to highlight the order first, and then we see these options of change, discontinue, hold, etc. So this is where you can discontinue an order if the provider would like you to discontinue an order. So I am going to just go ahead and discontinue this INO just for practice. So I'm going to highlight that, discontinue, and then it's going to ask for the date and time I'd like to discontinue. I'm going to put now and OK. And then I'm going to go ahead and delete all these to clean up my work list. So I'm going to mark for delete and then highlight these items and OK. I don't have anything else I want to highlight, so I'm going to simply hit OK past that. And I know that I highlight them if they show up here. If I've highlighted the events properly, they will show up here. We're going to have to do our read back. This is the telephone order. And then we can see up here in our order management summary that these are to be discontinued. Now, also, if you are chosen to discontinue something that appears in an italicized form here, that is a secondary procedure or order to a primary order. So you can't discontinue the secondary order, this here being the nursing patient care plan follow-up, without discontinuing the primary, which is the actual initial care plan. So in order to discontinue these, I would choose the primary order, which is the initial nursing care plan, choose to discontinue time of now and OK. And then I'm going to go ahead and mark for delete this event and OK. OK, one more time, and I can see that I have discontinued that event. I'm going to choose my read back, and then I can see up here that we're in discontinue of these. Then I would go to my order summary and choose accept. I hope that was helpful. Thank you.